Good afternoon, everyone. Myself, Dr. Aditi Patil, resident of Community Physiotherapies at Sancheti Institute of Orthopaedic and Rehabilitation College of Physiotherapy. Today, we will be discussing what is rehab and what is rehab team. Okay, so today we'll be saying what is a rehabilitation team. So, at the end of the topic, the audience will be able to understand what is rehab team, what are the goals of rehab team, what were the members of the rehab team, and what are the benefits of the rehab team. So, what is rehab team? So, basically, rehab team is nothing but the combined and coordinated use of the medical, social, educational, and vocational measures for training and retraining the individual to its highest possible levels of functional ability. Rehab team basically what they do is it is patient centric. The team is based on the necessary of the patient, what the patient needs. According to the needs of the patient, the rehab team is set. So the WHO also defines rehab team as the physical and the mental restoration as far as possible of the treating patients to normal the activities. Whatever activities he needs to do in his daily life to achieve that activities back again, the rehab team is formed based on the events which he is unable to do so that they may live able to resume their place in the home, society, as well as industry. So, at the end, the goal of the rehab team is to make the person independent in doing all his ADLs, all his activities, whichever activities he used to do earlier. After the rehab is done, he must be able to do the things independently. So now what are the goals of rehab team? So rehab team basically it helps in reducing the impact of disabling and handicap condition by making the person independent. Then they enable the disabled and handicapped to achieve social integration. That is to move and live freely in the society, to be active in the society, to actively participate in the society. They enhance and restore the functional ability, enhance and restore the functional ability by the means he needs what the functional needs the patient is having are restored by the rehab team. And their overall goal is basically to improve a person's quality of life by maximizing independence and outcomes. Next is the importance of the multidisciplinary rehab. So, multidisciplinary team is nothing but the whole rehab team. So the importance of them are first is to restore function. As the WHO also defines, we have to restore the physical as well as the mental and the functional capacities. So restoring their function that is able to do their activities on their own, developing the compensatory strategies if they are not able to do it. So we should advise them the compensatory strategies which needs to be done. Then by addressing the physical, cognitive, and as well as the emotional. So all the approaches like physical, mental, cognitive, everything should be covered. So now further we will be seeing the rehab team. So the first is the physiatrist. So who is the physiatrist? Physiatrist, they are the leader of the rehab team. They are also known as the physical medicine and rehabilitation recently developed specialty. Okay, so what they do is first they evaluate the patient. That is, they evaluate the patient, then they plan the treatment for them. Then they direct the treatment. They coordinate with the other sub-team members for the treatment. They motivate the patient as well as the other rehab team to do the necessary things needed. And they also check if the patient is going in the right direction. So they clinically assess the patient. That is, they evaluate the patient first then they arrive at the diagnosis after evaluation of the disability, and then they coordinate with the team members to chart out a line of management. So firstly they evaluate the patient, they plan the management after assessment of the patient, then they organize the management, they direct the team towards the goal of the patient, and then they also coordinate with the other rehab team. They form the rehab team based on the need of the patient. That is, the rehab team is formed basically on the patient centric. As it is patient centric, the needs of the patient are taken into consideration, and then the rehab team is formed, and they also motivate the patient as well as rehab team to take the charge. And they also focus on restoring the functions to patients with disabilities with the help of prescription of physiotherapist, occupational therapy program, orthosis, and prosthesis. So they evolve the patient, they do the management, the rehabilitation for further restoration what they do is they prescribe for the physiotherapist and the occupational therapist, and if they need any kind of orthosis or prosthesis for the functional regaining, they also prescribe the same. So this was about the physiatrist. Moving on towards the physiotherapist. So physiotherapist, their main aim is for movement restoration. So the how the movements are restored? The movement is restored by the muscle strength evaluation and quantification. First, they evaluate the strength of the muscle, then they quantify it. They check about the if there is spasticity, flaccidity, or anything else, and they measure the joint range of motion. First, they check the joint range, their strength, and then the neuro cases they check for spasticity and flaccidity. Then the exercises to maintain and increase the joint range of motion. So first the evaluation is done, then the exercises are started for the same. Then they also evaluate and train sitting and standing balance also. We all know the physiotherapy is very vast. It controls many domains, right? So the aid in the home evaluation, they also assess the patients with the wheelchair needs, including maintenance and assistance with individualized wheelchair prescription, progress the gait training with or without the ambulatory aids. Next, moving on towards the occupational therapist. So, this is the branch of science of directing man's participation in selected activities to restore and enhance the performance. That is to make the man again go back to the activities which can restore as well as enhance their performance. They also evaluate and train the patient in the self-care activities. The physiotherapist does the functional rehab. Here, they restore and enhance the performance by doing the activities. They explore the vocational skills. They provide the holistic training in home management skill. Holistic is nothing but involves everything. Each and everything is needed for doing the home management skills. So they provide the holistic training for that. They evaluate the home first and they suggest if the modifications are needed, they suggest the modification to provide barrier-free environment that the person should be able to do it, the things independently and on his own without any barrier. And they also prescribe use orthosis or any adaptive equipments whenever necessary. Whenever there is need for a patient to use the devices, they also prescribe the orthosis or any other adaptive devices whichever necessary. So next are the prosthesis and orthosis. So they are the ones whom the PT and OT sends for the prescribes for the orthosis and prosthesis. So here the prosthesis and orthosis, they coordinate with the physiotherapist, occupational therapist, and the biomedical engineers who make the orthosis and prosthesis to decide which is the best appliance for the patient. So what they do is they first take measurements, they do the fabrication work, they modify and change the design whenever required, fitting of the patient in static and dynamic alignment, repairs to the orthosis or prosthesis whenever needed. So when we send the patient, they first take the measurement, they form the orthosis or prosthesis, whatever it has been prescribed or whatever it is good for them. The fabrication they choose the fabric. There are different kinds of fabrication. They choose the best fabrication needed for the patient. Then they modify the changes as well as design whichever is required for the current situation for the patient. Then it may be they fit it as static or as a dynamic. If the patient is moving or is able to move, then the dynamic splint or the orthosis or prosthesis is required. They also repair the orthosis or prosthesis whenever it is damaged or the repairing is needed. So next is the rehabilitation nurse. So the nurse, the role is in doing transfers of the patient, maybe from the bed to chair or chair to the washroom, or then again back from chair to bed. The environmental facilitators, they do is sanitization, heat and noise. They control the personal properties, hygiene, as well as safety. All the basic environmental factors are seen by the nurse. The use of the maintenance of the adaptive devices is also checked by the rehab nurse. Specific preventive measures, if any needed by the patient, are also told and done by the nurse. The medications of the patient and the follow-up of the patient is also maintained by a nurse. Next is the speech pathologist. So, speech pathologist is someone who helps the patient in the area of communication and swallowing. So, if we see the speech, it also comments the communication, but they cover the area of communication as well as swallowing. So, what they do is they evaluate and treatment of the communication problems first, then the vocal rehab is started, then the speech training is also received, and the train the patient in use of the communication devices if applicable, then the patient and the family educations of what how to use the devices, what are the things needed to be done for the same. Then they also evaluate for the swallowing functions, and if they detect any problem, they also give the management for the same. So basically, they help the patient in the areas of communication as well as swallowing. Next is the psychologist and child development specialist. So the psychologist is who prepares the patient and his family members for full participation in rehabilitation. Okay, so the main aim is that they prepare the family members and the patients for full participation in rehabilitation. While the rehab is done, as the patient gets things that 2 months are over and still I have to do exercises, I have to get the training. So it is the role of the psychologist to tell him that to keep him mentally healthy by preparing him to be focused and in towards the rehabilitation. So they conduct the test dealing with the personality, the style of the patient's ways of dealing with the stress. It is also as it is patient centers, so they should know how the patient behaves so that the modifications can be told by him. Then the problem solving skill and intelligence of the patient, the level of problem solving skills he is having, the intelligence he is having, based on psychological status also. The incorporate of the above results into treatment. So first they check all the things the patient is having, that is personality, his style, his way of dealing with the stress, his intelligence, his skills, and his psychological status. And after checking all this, the treatment plan is made. Next is the musical therapist. So who does not love music, right? So music is one of the finest and the fine art, we all know this. So how does a musical therapist helps a patient in rehabilitation? So we have seen that playing an instrument like the keyboard, so when we are playing the keyboard or the violin, it improves the fine motor skills. And while dancing or exercising to any music, it is also known as the creative movement therapy. Nowadays the movement therapy is going on, in that the dancing or exercises to music is done. So this is a novel way to improve the gross motor milestones, that is the motor skills, the fine motor skills while playing the violin or the keyboard. And some children with the down syndrome also respond naturally to the music, so in some cases the music therapy really helps. So the music therapy helps in coordination and developing the gross as well as the fine motor skills. Like I have gave the example of the keyboard or the violin. While playing the keyboard or the violin, it improves the fine motor skills. Okay. And the relaxation, sedation, or control of the pain or anxiety is also there. Next is the social worker. So the social worker, they do the evaluation of the patient's living status and assessing the impact of disease or disability on the area. So due to his disability or due to his disease, is there any worst condition appearing in that area is checked, evaluated by the social worker. Next is the counseling of the patient as well as the family. The counseling of the patient and family is done by the social worker. They suggest any alternating living condition. If the patient is having some serious problem in this area, so they suggest the alternate living condition for them, helping the patient to make adequate social adjustments whichever needed, creating awareness in the community about the diseases and about the disabilities, help in pooling in together the community resources, and then at the last follow up of all the things which are evaluated by the social workers. Next is the vocational rehabilitation therapist. So they what they do is they evaluate whether someone can return to the job or work, and if so, how best is to accomplish this. If the person or the patient is able to do this job again, so what are the ways, what are the things which can be done so that he can get back to his work, and how can the person achieve it is seen by the vocational rehab therapist. So this may involve any use of the special equipments such as a one-handed computer keyboard. If somebody is disabled and if he needs the one-handed keyboard, so if this is an example, so like this many other changes which are needed to get the person back to work is done by the vocational rehab therapist. It is necessary for the cancer survivors also, if they think that they can go back to work. So sometimes the when they go back to work in an entirely new occupation, so at that time the vocational rehab may be offered, or they need the vocational rehab therapist to be with them to make them understand the new things and get back to work. Next is audiologist. So audiologist, what they do is they evaluate the treatment with the anything related to the hearing or the hearing loss. Next is the recreational therapist. So recreational therapists are those who uses the recreational activities to improve the social and emotional behavior. The patient's social and emotional behavior is recreated or improved by using the recreational therapist. They also promote the patient by assessing patient's interest. Based on the patient's interest, the social capabilities, their cognition, emotional functions, and level of orientation, the recreational therapist decides the activities to be taken for the patient so that he may develop or promote development faster. They also educate patient in leisure activities with specialized equipments, adapted sports, and alternate to existing lifestyle. They first check the interest of the patient, that what all interest, what all things the patient is having interest, and based on that, the activities are planned for the patient. Next is the dietitian. So there is a special role in weight control in overweight or obese, or in the underweight. Both the underweight or the obese, both of them need the dietitian. So the special role they play, it is in the weight control. And with the patients of diabetes mellitus, cardiovascular diseases is also taken care by the dietitian, as they help in the diet plans that are patient centric or the person centric and disease specific. So the underweight will have the different protocol, overweight will have the different protocol, overweight with diabetes will have the different protocol. Likewise, each disease will have the different protocol or the different diet chart. So the dietitian will give the different patient centered and disease specific diet plans. They also promote healthy eating, which enables the patient to make healthier choices once out of the hospital. Next, we will see now the benefits of the multidisciplinary approach of rehabilitation. So, what they do is they caters all the aspects of patient care. As we all have seen that this rehab team, it is a patient centric approach, so it caters all the aspects of patient care. They check whatever things the patient needs, they assemble it, and then based on the things or the care the patient needs, the rehab team is formed. Gives tailor-made program for each patient. Each patient has specific disease, as we have seen just now. The patient needs, they have different conditions, so they need different rehabilitation. So based on that, the tailor-made program is made. The increased communication between the healthcare workers. Being a rehab team, the inter coordination, as we have seen the physiatrist, they evaluate, they first treat, plan, organize, and coordinate with the other team members for the better rehab. So this is what is increased communication between the healthcare workers, and then the better follow-up is needed. Okay. Okay, so I think this is clear to you all. So this was the end of the today's topic, that which was what is rehab and what is rehabilitation things. So now I would like to thank you all for the Physio TV viewers, and special thanks to Miss Manisha Sangvi ma'am, the chairperson of Physio TV, Dr. Apurva Shimpi sir, principal of Sancheti Institute for Orthopaedic and Rehabilitation College of Physiotherapy, and the entire physiotherapy team for their encouragement and support. See you soon. Thank you.